It's Dana
and Ashley,
and this is A Dash of PT.
So we are back this week to talk a little bit more about the pelvic floor, which is a little bit more of my specialty. Right. And so Dana's here to help lead the charge with it, though. And so we have our friend, the spine.
Most of our friend is missing, if you can
yes,
tell.
But so I want to talk a little bit about this. But first, I made a drawing. So
yeah, like what exactly is the pelvic floor, Ashley, and what does it do?
So this is a boat, and these are the lines, and hopefully you can tell that's water. I'm obviously not an artist, but the boat represents our organs. So think of the boat as the organs, and then the lines are the ligament and fascia and muscles, and then here the waters are pelvic floor. So you need all of these working together so the boat stays afloat and it doesn't sink. So for example, if the ligaments and fascia and muscles aren't doing what they're supposed to do, then the boat might sink. Or if the pelvic floor isn't doing what it's supposed to do, then again the boat's going to go down. So it's all connected, this lovely very complex region. And it's
complex, but really, I mean, that's like any other region of the body, the
yes.
relationship of the fascia and the ligaments and the bony structures too. I mean, they all play together, so this is really no different than any other body part.
I think the difference in this area is that people don't tend to talk about it. So if someone's having shoulder pain, people talk about their shoulder pain or they'll go get treatment for it. But a lot of times issues within the pelvic floor, either one, people don't know they have an issue, or two, it's embarrassing so they don't want to talk about it.
Right.
Or it's just something that they think is normal because everyone they've talked to has the same problem.
I'd say a lot of people too, and just since talking to you and just increasing my awareness of it also, that they think it's something else. It's attributed to another problem altogether.
Yeah.
So can you share with us a little bit more specifically, what is the boat? Can you show us on the model what the boat is and what's around the boat?
And we don't have all the parts of our friend here, but so this is the bony structure. So you have organs that kind of sit on top of this here. And then if you can picture,
turning around
back here, obviously there's still organs in here, they're just removed on this model. And then you have ligaments and fascia and nerves and a blood supply all within this area. So it's a complex area and it all needs to work together in order for function to occur. So I think a lot of times people talk about pregnancy and childbirth and how that can affect the pelvic floor, and that's true, but there doesn't need to be that to have issues within the pelvic floor.
Right.
So right here, just to show an example, so this is our fake hamstring muscle. So this is if you were to look at your own back, so if you were to look at your butt, so your hamstring comes from the pelvic floor and goes down behind your knee. You also have these ligaments in this area. My favorite one is the sacrotuberous.
So the sacrotuberous ligament kind of goes in between the pelvis and your sacrum right here. So this red band shows where that would go.
So if you can see, there's a lot of connection within this area. So if a lot of times we have people that have recurrent hamstring issues. So they'll come in, they'll have no pelvic floor issue that they're aware of, but they'll have this ongoing hamstring issue. And so lately, especially now that I've gotten a lot more education on this, I like to ask whether they have any history of pelvic floor issues, just to kind of trigger their brain to think, oh wait, yes, I have had some issues in the past.
Yeah.
Because sometimes there's a link between the pelvic floor and issues further down the chain, so for example the hamstring, or even further up the chain mid-back. So it's all connected.
So when someone comes to you and starts complaining of maybe they think they pulled their hamstring, or what kind of symptoms or keys are you looking for in terms of presentation so that you're kind of dialed in that there's a pelvic floor issue? Are there common symptoms that people typically have, or is it strictly an incontinence issue, or so what does that look like?
So it's a little bit of a combination of all of the above. So sometimes people will come in and after I question a little bit, they'll say like, oh yeah, that's right, I do have some incontinence. So they might pee their pants a little when I jump or run. And so then it's cueing me in, like, maybe we need to address the pelvic floor. Sometimes it's not something that they're even aware of. So, for example, someone might be really athletic and work out a lot and have good muscle tone, and they're coming in with a hamstring issue, maybe from running. And so they're not having any incontinence, but when I talk to them more, I start to think, well, maybe they have a lot of tone, bad tone, in their pelvic floor, which is contributing to some of their reoccurring hamstring issue. So sometimes it's not something that they're actually noticing. It's something that I might notice once I start assessing things.
Sure.
Other times it is something that I'm kind of digging for as I'm talking to patients to see whether or not they are having some ties between the pelvic floor and the hamstring, or other issues.
So this is just like any other part of the body that we would assess. We always assess above that area and below that area to see what other tissues are involved. So this is a very similar type issue, just this is a specialized area.
Yeah.
So not all of us even really think to get into pelvic floor, and maybe that's a big contributing factor to someone's dysfunction and symptoms.
Because sometimes it's a matter of, when Dana said we look above and below, so when I look at pelvic floor with individuals, I'm looking at the pelvic floor, but I'm also looking at like rib mobility, mid-back mobility, how a patient's breathing. I look at strength in their hips. I look at mobility in the hips, because it all has to work together. And what happens when people start having problems is something isn't working like it's supposed to, and it's throwing everything else off. And I think what people don't realize is a lot of times the pelvic floor is a big driving force for other issues elsewhere. Yeah,
it can be that missing link piece that you get treated for the same thing over and over again. And if you keep skipping the pelvic floor, that these problems just keep creeping back.
Yeah.
So. And
there's a lot of issues that can happen just in the pelvic floor too, without having connections to a hamstring issue or a mid-back issue. So, incontinence, whether that's after pregnancy or just, throughout life, we're looking at why that cause is, and there's many. Prolapse, so if the bladder isn't supported and sitting where it's supposed to, it can sink down, and that can cause issues, whether it's discomfort or issues with urination. Pelvic pain. So really there's a lot of different things that can be going on just in the pelvis itself, but it has a connection with things down the chain and up the chain as well.
Yeah. This is super interesting to talk about, and I know as we continue our dashes throughout the year, we're going to keep coming back to this and getting a little bit more specific with different problems that can come up and how Ashley would treat them, because I'm not going to dive into this specialty, but I definitely want to learn more about it. Is there anything else that we need to cover today?
No, and this is a complex area, so this is just sort of hopefully an overview of what exactly the pelvic floor is and how it's connected above and below, and how ongoing injuries can really be coming from the pelvic floor.
Right.
So hopefully it, open up everyone's eyes to that. And if there are specific questions, you can always leave them in the comments section.
Absolutely. We love those.
Yeah, we do. But like Dana said, upcoming dash segments, I'll be kind of going into different topics within women's health to give a little bit more detail on those.
That's great. I'm looking forward to those. Next time, so in 2 weeks, it's my topic.
Yes.
And I don't really even know what it is, so you'll see it soon.
Something exciting.
It's always something exciting, right?
Yes.
But until then, thanks for watching us, and we'll see you next time, everybody.
Have a good week.
Bye-bye.